It's Heart Health Month, and there are things you should know that might help save a life. So please welcome from Elmhurst Hospital, Dr. Michelle Meziere. Hi, Michelle.
Hi, thank you.
Dr. Michelle, you are an ER doc, and what do you see in the ER?
So we see a lot of chest pain in the emergency department.
Yeah.
And not all chest pain is a heart attack, but it's important to talk about it because in the United States, the leading cause of death remains cardiovascular disease. And what that means is that 1 out of 3 deaths in the United States is attributed to cardiovascular disease.
Right, and aren't those stats higher for women?
Those stats, women do not survive their heart attacks as well as men.
Right.
And in the United States, every 40 seconds, someone has a heart attack.
Oh man, okay, well this is a major issue as you just pointed out, and we wanted to do a game where we call Fact or Fiction to see how much people really know about this topic. So let's start off with the very first thing. Heart attacks affect people of all ages. Audience is gonna play along with us. I'm gonna say this is a fact.
This is a fact. So the average age of a first heart attack for a man is 66 years old, and for a woman it's 70. But people in their 20s can have a heart attack, and the youngest person I've ever seen have a heart attack was a teenager.
Really?
Really.
And was it because of there was some disease or history in the family?
It was some disease and some family history.
Oh boy. Okay, all right. Heart attacks run in my family, so I can't prevent one. That's another fact or fiction. Audience, weigh in. Heart attacks run in my family, so I can't prevent one. I'm gonna go with fiction.
It's fiction.
Yes.
There are risk factors that you cannot change. So you cannot change increasing age, you cannot change male gender, and you cannot change your family history. But there's a lot that you can do to help your heart health. The number one thing is to quit smoking, control your blood pressure, your cholesterol, your weight, and to promote physical activity. All of those things will increase your heart health and decrease your risk for a heart attack.
Awesome. Okay, let's do this one. Women often feel heart attacks different than men. I'm kind of torn on this one. I'm going to go with fact.
Yeah, I'm going to go
It's
fact.
a fact.
Yeah,
It's
it
a
is a
fact.
fact. What
So-
do we feel that men don't feel?
So men will feel the typical symptoms. They'll feel pressure in their chest, pain in the left arm, they might get sweaty and short of breath. But a woman might feel the shortness of breath without any chest discomfort, or she might just feel fatigued or lightheaded, or she might complain of acid indigestion rather than the true chest pressure. So it's just important that everybody recognizes that these can all be symptoms of a heart attack.
Okay, good information. Here's another fact or fiction. Taking an aspirin can stop a heart attack. Oh, I'm gonna go with fact.
I'm gonna say
an
fact.
aspirin a day keeps a heart attack away. Is that true or no?
So I feel like this is a trick question. Aspirin is very important in the treatment of a heart attack. It is important for its blood thinning properties, and it can improve your chance of survival, but aspirin alone cannot treat the heart attack. So it's important to seek medical attention in addition to taking your aspirin.
Okay, is it something that maybe can prevent if you do take it every day? Is there
It
any
can help
benefit in
prevent.
that?
There is benefit for a certain population.
Okay, all right, and here's the last one. 70% of all sudden cardiac arrests happen in the home. 70%. I'm kind of torn again on this one, but I'm going to go with fact.
You're correct.
Okay.
So this is important because this is going to happen in your house, and the important thing to know is to call 911 and to start CPR right away. If you are out in public, you know, there are increasing numbers of AEDs in the public, and that would be something that can help in the public sector.
Right. It is really important for us all to take CPR classes, but like you mentioned,
absolutely.
if you can't, there are devices in the public, and Ryan is going to talk about that, right?
Yes, I am with Wendy Murphy from Edward Hospital's Community Training Center. First, tell us the difference between a heart attack and your heart stopping, because there's some confusion there.
There definitely is. If you are having a heart attack, you're experiencing some symptoms because you have an artery that's blocked, and that is putting pressure on your chest, shortness of breath, but you're still alert. Somebody who is experiencing sudden cardiac arrest, that person, their heart has stopped, they're unresponsive, and they are not breathing normally.
Right, and that's when the AED device can come in and save a life. life.
Definitely. That's exactly what it does.
Right, so take us through what the AED device does exactly, and the fact that a lot of people don't know, these are at your work a lot of times. They're in public places. Sometimes we just don't know where they're located.
Exactly. So it's time to start looking around for them. There's usually a sign that indicates a heart with a lightning bolt through it, and that's what to look for. But if you work somewhere, find out if they have them, find out where they keep them, and then ask your building manager if you could just take a peek at it so you know how yours runs. They are all very simple, but they run a little differently, so have access to it, figure it out so that you could possibly save a life.
All right, so
okay?
take us through this, Wendy.
So real quick, before we get the AED in action though, I do want to mention that if you do come across somebody who's down, you of course need to make sure the area is safe for you. All right, and then you're going to tap and shout on the guy to see if you can get any kind of responsiveness.
Okay.
All right, and when he's not responding and not breathing, you've got to get someone to call 911 and someone to go get this AED for you.
Right.
But when this comes back into play, as soon as it gets on the scene, we want to use it. And the very first thing you do with it is turn it on. As soon as I do that, it's going to give you audible prompts, and the case also has directions in it. Okay, but we're going to use these audible prompts today. As soon as I turn it on, it's going to say apply the pads.
Right, and obviously you need to lift the shirt. You cannot put this on over clothing.
Right, it has to be on a bare chest. So we're going to put those on.
Okay.
All right, it goes in the upper right and the lower left. That one's going to be placed right over here.
And do they typically have them on the pads like these?
Yes,
These are right
exactly.
here on there?
Yep, the
Apply
pictures,
So this is
follow
showing
your
here.
pictures. Yep. Put that one there.
This is showing here.
Yep.
Underneath.
That's correct. And then you're going to plug in this connector. And as soon as I do, it's going to say it's analyzing the heart. And you can't touch because it'll pick up your pulse. So we got to make sure no one touches.
Okay.
Do not touch the
So
patient.
everybody's clear. And then it's going to say a shock is needed.
Shock advised. Charging.
We still don't want to touch. And before you
Stay
hit
clear
this
of
button,
patient.
you want to make sure everybody's clear because you're going to deliver a shock tube. So
Deliver
we've got to make
shock
sure
now.
everybody's clear.
Press the
You can go
orange
ahead and hit that
button
button.
All right.
Shock delivered.
And then we want to resume CPR
Pause.
immediately. If the shock worked,
Begin
he'll let
CPR.
us know. He'll show some signs of life.
Okay, and if it doesn't work, you wait for 2 minutes?
Yes, but you're going to be doing CPR during that time.
Got
and then
it.
in 2 minutes, it'll come back on and reanalyze the situation and tell you if it'll shock again. If it does say no shock advised, we continue with CPR. We do not stop CPR.
Got it. Thank you, Wendy.
Until 911 arrives.
All right, for more information on Edward Elmhurst Health, go to wendycitylive.com. We'll be right back, everybody.